Hi, my name is Renee, and I'm going to be doing my presentation on family planning and contraception. What is family planning? Family planning is education about everything that surrounds sex and pregnancies. Family planning services include contraception, STI, STD, and pregnancy testing and education, infertility services, and breast and pelvic exams, and other services. These services and more are offered for free at Planned Parenthood and other clinics with their family planning benefit program if you're eligible. Why is family planning important? Family planning is important because without access to birth control and comprehensive sexual education, there is a significant increase in unwanted or adolescent pregnancies and STDs. Right now, the US has the highest adolescent pregnancy rates in the industrialized world, and adolescent pregnancy causes many physical and social risks for the mother and child. Family planning is also important for infertility and individuals who are having a hard time getting pregnant. The Affordable Care Act is a comprehensive healthcare reform law that was enacted in 2010 by the Obama administration. The Affordable Care Act makes affordable healthcare insurance available to more people, and it also expanded the Medicaid program. This means that it required insurance companies to cover birth control at no cost, which also increases access to family planning. So, moving on to contraception, kinds of contraception are temporary methods such as hormonal IUDs, barrier method, and the morning after pill, and permanent contraception such as sterilization, which is vasectomies for men, and tubal ligation for women. So, hormonal birth control is a method that uses the hormones estrogen and progestin, or progestin alone. These hormones affect the levels of hormones that a woman's body naturally makes and prevents the ovaries from releasing an egg during her cycle. It also creates a mucus layer around the cervix to prevent sperm from getting through. Hormonal birth control includes the birth control pill, patch, ring, shot, and implants, and these methods require prescription from a doctor or clinic. So next, IUDs are intrauterine devices. This is a small plastic or copper device that's shaped like a T and is placed inside the woman's uterus by a doctor. IUDs work by disrupting the normal uterine environment and sometimes releases small amounts of progestin, which prevents pregnancy. They also reduce menstrual bleeding and cramps, and they can be left in for 3 to 10 years. Next is the barrier method of birth control. These are condoms, diaphragm, and cervical caps. A condom is a thin layer of latex or polyurethane sheath that covers the penis during intercourse, and it must be worn at all times during intercourse to prevent pregnancy and reduce the risk of STDs. Diaphragm and cervical caps are flexible rubber cups that are placed on the cervix before intercourse and should remain in place for 6 to 8 hours after intercourse. Cervical caps require a doctor prescription, but condoms you can find at any drugstore or grocery store or anything. Finally, sterilization. Sterilization for men are vasectomies, and these are done by cutting and sealing tubes that carry sperm into the sebum. And then for women, it's tubal ligation or tying tubes. Uh, this is done by cutting or permanently blocking the fallopian tubes by cutting and cauterizing, uh, cutting and tying, or banding. Both of these methods, while sometimes reversible, are considered to be permanent and prevent pregnancy. That's it. Thank you.